All right. Let's see if we can figure this out. There might be a little craziness going on around me, but that's okay. All right. I don't need that. Ta ta ta.
See you later. In the morning. All right, bright and early. We're doing it. All right. I know that's. I'm going to be leaving here shortly.
Right. I'm not really sure. Of course, this is always new and different every time I do it. So hopefully we'll get some folks to show up here in just a moment. We'll get started for real in about 10 minutes, it looks like. Somewhere is always the chat box, and I can never find it.
Ooh, burn. Look at that, guys. Look at that. Look how tiny that is. Like, are you really trying to tell me that I'm supposed to see that?
You're not going to see that.
Public health.
Renee, I'm live streaming here, so, and no, I can't read that. You probably need to copy that to a Word document.
See you in the morning. Bye.
Good night.
Thank you, Liz.
Ta ta ta.
Okay, I'm going to make a feeble attempt to help you. Life is good.
I'll make this. Hey, Kristen. I think you've made it to every one of these so far. Oh, we actually have 4 people on. I was going to say, holler when y'all get online and tell us where you're coming from. You have to ignore the bedlam here in the background. We are getting ready for, yes, you know it, it's National Herb Day. Woo woo! Okay, really it is in about 12 hours.
Right in right now that I'll put it back on the bed.
Ah, there we go. I found the chat. Hey, Jane.
Okay. Try to make these. Let me get on.
All right. And Renee's here as well. Yay! Well, she's almost here.
I'm trying.
Uh-oh. That's awesome. The master plan, honey, and I know Renee made
I did.
She just had
I
the last of hers, Kristen, up in Carolina.
Yeah, I made it. It's the only
and so I think
time I made it.
Yeah, and so she just made a fresh batch last night.
Mm-hmm.
So if there's any left after Herb Day, you'll have to yell at Renee and we can send it up to you. Turn the chat. Turn your head.
Okay. Is that okay?
Yep, I think we got it right now.
All right. Okay, so I am here to moderate.
And ignore the apothecary manager scrambling madly in the background.
Doing her very best to get the hell out of here.
So we are. I had grandiose plans that I was going to do a cooking demo as part of the open forum tonight, but I haven't even made it home yet. So I still got to make it home, cook up all the wildness of National Herb Day, and in North Florida. Oh, that's awesome. One of the goals, one of the things we used to do, Jane, is whenever we drive up to, we lecture up in Atlanta sometimes, and some of the conference we teach at International Herb Conference, and we always get a few requests of folks to come do herb walks or do a lecture, North Florida or somewhere along the line, and we've always tried to do those on our way to the other conferences. So, of course, for the last year, and unfortunately until probably next year, most of the herb conferences got canceled. So maybe we'll. Oops. Oh, mine's, I think, up all the way. Hopefully you can hear me. Can you hear me now? Hopefully, as we get going with conferences again, maybe we can start to do some of those things.
Jane or somebody else, let us know that the volume got better.
Somebody give us a thumbs up or something. Hopefully it's working. I don't know. Can you hear me now?
We're on a delay.
No, so that's true too.
You have to give them a second to see it.
So we got 5 minutes to get it right. Yeah, my volume's up as far as I know. Yeah, my speaker's up 100% on that. So presumably the volume is rocking. So, well, if somebody doesn't give me a thumbs up, I'm going to madly scramble and figure out why. Okay, good. One of us had a glitch.
Okay. Good job.
A glitch in the matrix there. All right, good.
Nice. Thank you, Lauren.
Oh, that's not our graduate, Lauren. No,
it's not. It's a different Lauren. So
awesome. Well, we'll get going here shortly. We got another 5 minutes before we get started, and I know we got a couple of somebody else besides Britt gave us some questions.
Yeah, so
they were great ones.
We're gonna have 2 questions that are about. It's just really interesting because we have a lot to actually say.
I know. I read those a couple of days ago, and I was like, "Ooh, we got things to say on these." And it's funny. Renee and I will have very different things to say, and they're a different kind of question than we had. So I like it. I like it.
And so we can definitely talk about that. I also didn't know if you had something in mind that you wanted to talk about specific to Chinese medicine, or
HerbDay.
whether we wanted to have a conversation, especially considering the questions that had come across just recently to us about what you can do it, about what adaptogens were. Remember that whole thing we were dealing with? Other way. This way. There you go.
There we go.
Yeah. HerbDay.
It's HerbDay. Wow. Oh, this is hard to do. This takes skills. Hope the door's locked.
Do you want me to lock doors? Oh. We are.
Hey, Lily. Tell them to come back tomorrow. So, yeah. This is our 15th annual, and I don't know whether we canceled last year, so I don't know whether they counted last year or not. So it is definitely a bunch. Whatever 15 years ago was. I have to take my shoes off to do the math for that.
You're such a hillbilly. Okay, are we at time yet?
Oh no, we got 3 whole minutes.
We scrambled.
And anybody
ahead of time.
Right? If anybody's on here and wants to toss a question in the chat box there, please do. We got a couple queued up that I'm excited about, and I'll take all of 2 seconds to talk about National Herb Day.
And then, hey, you guys, because I'm moderating, Bob's right. Like, you can start to throw things up. We do have a couple questions. We can talk about the Lichen Sclerosis. Do you remember that? That autoimmune, that's like terrible.
Yeah, I don't know why that came up.
Because it was asked about that we recently have a doctor in town that's kind of telling people, oh yeah, it's a very common thing, it's very normal, here's some hydrocortisone cream, and I was horrified by that statement. So
if anybody didn't see it, so although we have noticed our flyer looks a lot like what I just posted. So HerbDay.org is kind of the overseed organization. I will say, although I love them dearly, they're less than perfect on the keeping their website up to date. So although it does have this year's date on there, you can find out a little bit more about what is HerbDay, that it is a national decree. There's a national decree for everything. Hey, Gina, what up?
Hey, Gina.
Yeah. But they've got some nice information on there, and I know they got links to a couple of other cities that are doing things, some online. So if you're not able to join us tomorrow live and in person, you can check out some of the stuff online.
Yes.
Oh yeah. Say hi, Christina.
Hi.
Wah wah. She's the one, if you ever call or email about herb stuff, she's usually the one answering, filling your orders, and making sure we always got stuff on the shelf. She has to take care of all that stuff behind us. It's insane. And that's only, you guys don't even get to see all of it.
It's funny because she knows all the Chinese names and I know what to do with them. So I'm coming over all the time and she's like, now what is this? It's like, I can tell you, once I get to the plant, I can tell you.
But those are the only two herbs. I swear there was nothing else.
Maybe. Do you want me to?
No, it's all right.
Look?
We'll go with it.
Mm-hmm.
And I don't think Britt got anything to us, but that's okay.
No, but I can fire up some questions. We can do some nervous
It's 6 o'clock. Woo woo. All right. Hey all, it looks like we got a few people showed up, outstanding, and I don't care about virus threat protection right now.
You do? Oh, I got my.
If you don't know it, I'm Bob Linde, and this is Renee Prince. Wait, what? There we go. And we're coming to you from Acupuncture and Herbal Therapies and the Tradition School of Herbal Studies here in St. Petersburg, Florida. And you can find out more about us at traditionsherbschool.com or acuherbals.com. And if you don't already know it, we've got both a Western and a Chinese herbal program here, all the way from beginner to practitioner. One of the very few schools in the nation that has actually intern practice, where for the Western, for the full year, you do one night a week that you're seeing clients under our supervision. And with the Chinese program for about a year and a half, we're here doing clinical practice one night a week where you're supervised so you don't kill anybody. And we also have now online classes, which is really nice. You know, COVID is a pain in the mouth and the chin and the nose and the ears especially, but it has forced us to go online. So we are taking people live streaming for our classes now. Obviously, the clinicals are harder to do that way. But I know a lot of people, for some classes, try to show up, or we do the best they can, or you can find a mentor in your community. So, I don't know. So we started back in December, I think. I felt I felt detached from our community, and we were so used to lecturing out on such a regular basis. And I just felt like we needed to make sure that just our community stayed connected, that information continued to flow. So I saw a couple of other people in the acupuncture realm were doing this, and I was like, you know what? We need this for the herbs, both East and West. And so we started doing it, and we've gotten such a good response, both locally with our students and our graduates, but also just people everywhere around the world, honestly, which is super cool that we've had some folks from Europe and Canada, and I forget where else. So we're now doing this the last Friday of every month, and I am completely insane because we do have a huge Herb Day event here every year, and I have no idea what tomorrow will look like, but tomorrow morning I'll be here sadly at about 6 a.m. But the event runs from 10 to 4, I believe. We'll have lectures, 2 lecture tents going all day. Our senior students will be lecturing on the topic of their choice, and we'll have the practitioners senior tent talking about random stuff. We have almost 20 vendors. We have 2 musical acts. I know the Urban Gypsies of Florida with Barney and Lita, and I totally just drew a blank on the other band. I'm so embarrassed. I apologize. Maybe Renee will spot it for us. And we'll have lots of herbs and new honeys and a crap ton of plants, some that people probably haven't seen in this area before. There we go. Mother tongue. And I think I've heard them before, and they had a real eclectic sound. So if you do make it by tomorrow for some or all of the festivities, and 99.9% of it is outdoors, so you should feel pretty safe. We're making sure our vendors are masking up, and we encourage you all, even if you're outside, because people might be bellying up to you, to make sure you wear a mask when you're in crowds as well. And I'm going to somehow, after we're done with this, and we're going to stop right at 8 because I'm going to run home. I got to cook up some wu chi pai feng, which is the black chicken white phoenix soup. I'm going to do a 8 treasures congee, a jellyfish salad, and tomorrow morning I always get up early and make a fresh bitter melon stir fry. So I've got my work cut out for me, and I feel like we've just started on the decorations and movement to stuff here. So a lot of it just happens tomorrow. So I hope I see a lot of you out here tomorrow to have some fun. So enough of me babbling and self-promotional coolness. And if you missed part of this, by the way, we'll be posting it on Monday on our YouTube channel for the Traditions School of Herbal Studies. What was the first question? I think that was from Kristen, wasn't it?
Oh, yeah, but hold on. I do want to do
But there's more.
We're going to do a check-in because more people have signed in, and just say that
Yeah, we got a nice crowd.
I'm moderating, so that please fire away any questions that are about herbs, about conditions, about the meaning of life, about spiritual crazy, about anything, needling, acupuncture, Chinese, anything like that you want to do. And I will make sure that Bob is hearing them and we spout off our 2 cents worth. So we do have several things that need to come through. So the first thing is we're going to talk, Kristen had sent us some things, and the people who bother to actually email us get priority for sure. So it was specific about 2 herbs in particular, and the way that they had traditionally learned them versus the way that we would use them. And so that's what I'm going to go for, and that's how we're going to talk about it. So then as we go through it, Bob just went and grabbed something, we can both argue it out and see. So I'm going to actually read what Kristen wrote, some of which, and then we can decide where he wants to stop us. So the first one we're going to talk about is lady's mantle, which is a really different herb. Like, we do use that one in a different way, and it's a weird plant that does this weird thing. And what she says
is, do you want to bring it in, or I can go get it if you want to talk for a minute? We have one up.
Yes, but hustle, and you may not know where it is, so don't dilly-dally. I changed it all around. Hustle. Bob here, so you're not looking at a screen. So Bob is going to retrieve it from outside. We have our big event tomorrow, and so I moved all of our plants around. Yes, we do have it growing here, which it totally doesn't want to grow here. And it's one of these special plants that have veins or corridors in it that allow certain moisture to come up on it. As a wise woman practice and a folk medicine, especially with something like, something like a trauma or a PTSD, in a druid thought process, we would actually use the dew that came up around the lady's mantle, except it's not really dew, that's fake. It's actually coming from the internal of the plant, and it's a special thing that this plant does. So that's something to think about, that we'd be harvesting that instead of the plant. So that's one way that we could think about the medicine. But traditionally, from a wise woman practice, and I'm saying wise woman practice because it is considered to be a womanish type plant. Here he is, he can show it to you. And I was just talking about the water so that you can show them.
Yeah,
Can you get way up to the right there? Yeah. And see that water on there, boiling hot outside, and it's suspended in there. So we would collect that water. So what the question is it's definitely beautiful and become one of her favorite plants, and it's not around a lot, and there's not a lot of experience using it. And she would have read about and known it as an astringent plant, a reproductive menopause year plant, maybe for shrinking fibroids in the uterus or the breast, maybe as an infused oil, supportive during the transition times that we would be going through as women. Many things that were like that, almost like a yarrow type of styptic. And it would be combined with any of the nutritives that we would know for women's tonic. Now, especially since we have such a eclectic group of people here, we have to specify that tonic in Chinese medicine and tonic in any other herbal medicine that's considered European or Eastern Bloc means two different things altogether. From a green man, wise woman practice, saying something's a tonic herb would mean that you could just take it all of the time, as much as you wanted, and just eat it like food. And knowing energetics, that's just never the case. Like, you should never have broccoli all the time. So even though we would use it that way, that it would be used with tonic herbs to help a problem. So red raspberry or red clover or things like that. And so I would agree with that portion of it, that you would use it in combination with these herbs that were going to help a body system get back into its original state of being. And so that's something to think about.
I was going to say, for me, and I think Renee said it as well, I know from the name Lady's Mantle, the idea, and there's a bunch of questions that came up.
I'm coming to go through them right now.
And that it is a mantle of protection, or a cloak of protection. And so, although we can certainly use it for more physical medicine kind of things, I always think of both carrying this herb in a medicine pouch or in a pocket, or even in small amounts, as Renee likes to say, a fairy dusting over the top of a formula, to literally provide that protection. And Renee mentioned, and you can kind of see it in the picture there, that this is not just morning dew kind of thing. Well, certainly not morning dew. It's it's the evening. But there's specialized cells here on this plant. It's a very unique plant that does seem to excrete this, and it will line up on the veins on here and collect down where the stem attaches. And I would call David Winston one of my mentors, and certainly somebody who's had a great influence on me. We did an herb walk with him at the North Carolina Botanical Gardens, I think it was, and took us around, and he talked about the Lady's Mantle was specific for PTSD and assault, especially for women, but men could use it as well. But it was about specifically drinking the dew off of a leaf, that provided a release and a protection from past trauma. And it's fascinating because it really is almost a nature's own creation of a flower essence. And if you've ever looked into flower essences, the Bach flower essences are a type of homeopathy, an offshoot of homeopathy that focuses in on spiritual, emotional, behavioral kind of things more than those physical medicine, like I've got, shoulder pain kind of idea. So really a fascinating plant that I think is underutilized and overlooked oftentimes. It's not one of those big heavy hitters that everybody talks about, those top 20 herbs. I bet you once a week I put this into somebody's formula, into their medicine pouch, or in some form or fashion. And it's exciting that we're able to grow it. It's a little tricky to grow here. It certainly isn't native to Florida. North Carolina north, it's very common, and I've even found it in North Georgia on rare occasions. So here in Florida, we can actually keep it in a pot, a little richer soil than our sand, and making sure, not wet feed, it needs well-drained soil, but maybe watering it a little bit more often than is average. And I think a couple of our students have managed to get one and keep it going quite nicely.
I'm getting questions. I'm getting questions coming in.
I know.
Yeah.
All right, I'll stop.
No, I love it. Okay.
Throw something at me.
So the other thing is, we got to continue this.
Yep.
And so let me answer how we would use this. So it's very appropriate to, and I want to always steer away from saying things like, we're using these plants, but we are begging these plants for support, and we're begging them to do what we know it's possible, and we're trying to be grateful about it and mindful about it.
So if you want to
Please hustle. Okay. And so in doing that, Bob's going to go grab another plant. And so in doing that, it is completely appropriate to go to this plant and ask it for support having to do with women's things of all kinds, in conjunction with all of those herbs that we would know to be tonifiers, for women's issues. But what I want you guys to all get out of your head, and this is how I teach my women's and men's classes, that we are not different in any way, shape, or form in the aspect of we all have an endocrine system and our balance of hormones dictate what goes on in our body. And so just understanding that for everything I'm saying, like if I say it can tonify the uterus, it can also tonify the lower jowl of a male person as well. Like it's not in any way going to be something that's only just limited to that. And so just thinking about that for sure. Sorry, my hair has been pinned up all day. I had to let that sucker down. And so if we think about it that way, and we think about using that for trauma or using that for prolapse, or one of the things that Kristen had brought up and it's something that's written about in all kinds of things, I think Deb Sewell talks about this, is breaking up fibroids or breaking up tissue that is congealed. And what we would see this as is phlegm, like extra phlegm that had a little bit of heat to it, and then it got hard and like very solid. And so that, yes, absolutely, I would use that in conjunction. But Bob, speaking about the homeopathic side of that, it's totally true, 100% in that, that you could use just a fairy dust of this for the idea of what's going on. Hey, will you go ahead and talk a little bit more just about this?
Well, we can go on to the next one. So I'm not sure at all. We didn't have a whole lot more to say about it that I know of. But the other one was about black cohosh. And I'm looking at... So black cohosh is interesting because it is both a Western and a Chinese herb. So we know this as shengma. And there's a lot of people who say they have different properties, and certainly there's different traditions between the Chinese and the Western black cohosh. But I find that they can be used interchangeably. One of the neat things, the Chinese use this herb for venting rashes. It's in the clear heat section of the books. And honestly, it's not used a lot. We don't have to vent measles or as much as, perhaps back in the day. It's actually something we don't even see anymore because of vaccinations. But we see this formula show up in a formula called Buzang Ichi Tang.
Are you trying to write it?
Yeah. And Buzang Ichi Tang, it is Ichi Tang. It's combined with the Shengma, Huangqi, and Chai Hu. And those three herbs together have this upward and outward motion that really makes Buzang Ichi Tang this really special formula because it's for deficiency, spleen qi deficiency, where we see a specific symptom of prolapse, the actual physical organs prolapsing or the feeling of something prolapsing, that this becomes magical. But in Western herbal medicine, there is a beautiful little baby black cohosh that we've managed to grow quite handily here. So black cohosh in Western herbal medicine has such a wide array of uses. And it's so funny. If you were to go, what's black cohosh good for? They're going to say menopause. I almost never use this in a menopause formula. I think it's probably one of the weakest herbs out there for menopause symptoms.
I would disagree with that, but we disagree regularly.
Yeah, it's really effective. And I think maybe when we do see it work, it's partly because it has an effect on a spasm between the below the belly button. And I think it has a specific effect on the psoas. And psoas is spelt funny. P-S-O-A-S. So the psoas muscle kind of connects our top to our bottom. And so it's an antispasmodic. So we see that I believe that the psoas, as well as a few other muscles, oftentimes cause a dysfunction of a women's reproductive organs, that it throws the ovaries and the fallopian tubes out of whack, and then ultimately causes a hormonal imbalance. And so I think its role as an antispasmodic for the low back and the psoas ultimately helps the reproductive organs and their hormones to function correctly.
I have a question about that. Like a tilted uterus?
Potentially a tilted
Because like
uterus.
it's, you know what I'm saying?
Yeah.
Like it's pulling in one
In
side
the right
or the other.
combination of herbs, it could have an effect.
Or even if you had like an ovary stuck because of scar tissue or
Right.
fibroids or something.
And so that's where I
interesting.
think of, and
That contradicts everything that we learn in like a green man practice. I'm just saying.
That's how I use it.
Well, because they would say it's used for actually like fixing the endocrine system, like a hormone issue.
And then I also, and I'll quote David Winston for this as well, is for male depression, the melancholia, but specifically
because it
for men.
lifts you up.
Yeah.
Nice.
So
those two together actually
have a unique kind of idea.
The lady's mantle and that together would lift everything up.
Yeah, might both be correct.
Mm-hmm. So I want to add insult to injury this because I'm going to ask you a question came in about SSRIs. Would you use either one of those with SSRIs? Okay.
Yeah, I'm thinking,
especially in low dose.
Yeah, low dose. I wouldn't think twice.
As an infusion, not
I wouldn't think twice about it in small doses.
Because there's a question about lower back pain.
As SSRIs, there's not a lot of research of those herbs. And when we start talking nutraceuticals, if you're using 5-HTP or some chemical extraction that is safe over the counter, may have an interaction with SSRIs. And of course, St. John's wort has an interaction with everything. And so where we run into problems is when we use like for like. If we're taking antidepressant like an SSRI medications, and then we take a therapeutic dosage of an herb as well, it's not that you're going to like fall over and die. It just means that we're going to get a little bit too much. So we're likely to get some of the side effects that we are trying to avoid at the higher dosages of both the herbs and the SSRIs. And so we might actually find fatigue. Antidepressants can cause, take care of depression, but they can also, you'll always see on the list, it also causes depression. And it's always about dosage. It can cause impotence. It can cause melancholia and things like that. So I always say adjusting your dosage as you use one for the other. And although we say that black cohosh has that uplifting, especially for men, effect, I wouldn't call it an antidepressant herb. And so
no, it's lifting you up.
Yes. Yeah. And so I think it's important that we don't always fall into the, is this a serotonin issue? It's like, no, let's look at this. We didn't know what serotonin was 50 years ago, much less 1,000 years ago.
Besides, we don't treat that. We don't treat medical things.
So I think it's really important that we use, if we're doing it from a Chinese perspective, it doesn't do all that. If we're looking at it through the eyes of the eclectics or some other system of Western herbal medicine, if we're looking at the Native American uses, actually, the Native Americans, didn't they use this for snake bite?
Yeah,
actually, this was used topically and internally.
Not only that, it helps to reduce the pain of the snake bite. It gives us horrible all over body spasming.
And it's funny, that would go along with the Chinese understanding that it would bend stuff, that it would have that drawing action of pulling out the poison. I'd forgotten that. So
definitely. So I have so many.
I was going to say I see a ton of questions.
Direction? I'm going to try to. I'll go.
I saw we don't get a lot of acupuncture and Chinese medicine, so let's. I don't know who that is.
It's half acupuncture, half not. It's really they're super good questions.
Because I saw a couple of good questions.
So this is going to encompass several questions within it, and it's somebody who asks really good questions of you who in the acupuncture vein. So it says between choosing to prescribe between herbs or acupuncture, like how do you come to that differentiation? And then the caveat to that is how are you convincing your normal clients, patients that herbs even actually works, coming up with this problem with diabetes and cancer.
Isn't that always the eternal question?
Thing.
Right, that's always the eternal
question. One, how do you choose? And two, what's your route? And I think that it's ironic because you are such an herbalist that you go to the needles last always. And so, it's and how do we convince people it works?
It's funny. And so that's a wonderful question. And I get asked a lot, how do you convince people to take them? But I don't get asked a lot of like, how do you decide? And just what Renee said, there's a little ego involved. I actually say I'm an herbalist by passion and I'm an acupuncturist by license, and I really like acupuncture too. And so a little bit of my ego gets involved because I'll sit there and go, I can fix that with herbs. Even though I might get there a little bit faster with the acupuncture. The acupuncture's, somebody has a muscle spasm, the sciatica or something like that. It's like, yeah, the acupuncture's quick and easy. And for acute injuries, acute pain, low back pain, a lot of the other stuff, we're freezing up. For a lot of the other stuff, I do like acupuncture. For stress, especially when people are feeling very anxious and stressed out, both chronic and acute, but and pain, I actually will frequently use acupuncture or acupressure. And I say acupressure because I use magnets a lot. I use ear seeds a lot. And so that kind of crosses, it's close to acupuncture, but it's not the same. And although I periodically, if I'm doing a free clinic where you're doing kind of just sitting in chairs, and I assist with, I volunteer at a couple of free clinics periodically. And we only use acupuncture. And so it's super exciting for me to do that because I have to use a different mind. Things that I would normally just use herbs and diet and lifestyle, and I may make suggestions to them. The only tool I have with me frequently is the acupuncture needles. So I have to really start to explore some other ideas if I'm working on insomnia or a digestive issue. And so for me, that is fun. But I prefer using herbs for chronic disorders, digestive issues, blood flow issues, in that blood stagnation concept in Chinese medicine, menstrual and fertility issues, for cancer. All of those I actually, and I'm sure I could come up with autoimmune disorders, I actually prefer herbal medicine. And I think has a both more cost-effective and is actually going to fix the issue, and it takes time. For pain and stress, especially things that are involving kind of that HPA, sympathetic, parasympathetic nervous system idea, I think the acupuncture gives us a quick reset for that oftentimes. And so if somebody's in pain, nobody should be in pain. We need to as quickly and effectively provide them at least relief whilst we go about trying to repair whatever physical or energetic idea that's broken. And I think, and everybody forgets this, herbs are great for pain, and can oftentimes fix pain. A lot of pain, sorry for those of you that aren't familiar with energetics, but a lot of pain is rooted in deficiency. And so by nourishing the body, we can fix a lot of pain. When we see weather-related pain, where it's like, oh, my shoulder kills me every time a cold front comes through, herbs will have the greatest effect, and moxibustion. And so the other part of that question was, how do we convince people to do it? And it's funny, I don't convince anybody of anything. People will oftentimes schedule with me for acupuncture, and they come to see me for any number of different reasons. It's usually word of mouth, but I got a rep. I've been doing it long enough. It's been 20 years. And so that has some legs, and I generally speak with a level of confidence. I code switch. I can speak crazy Chinese medicine. I can talk crazy Western herbal energetics, and I can hold my own talking Western medicine as well. And so I find that if I build trust with my client or my patient, if I give them my best advice, the majority of times they're coming to me, they pay me money to get my expertise. And if I tell them, I know you came in here for an herb consult, but I really think you need acupuncture for this particular issue. This is what this would be my best guess of what this would look like and what kind of success we can expect. Or they might come in for acupuncture. I was like, you really don't need acupuncture. I'd just be taking your money. I'm happy to do it, but I think what you really need is some herbs and some dietary changes. And people tend to go with if I am an expert, and if you're a licensed acupuncturist, you are upon graduation instantly an expert. So if we act in that way, if we're good at what we do, I find it's very easy to make, like, here is your best course of treatment, and I'd like to make an herbal formula for you. And you'll probably be on it for this long with some adjustments every 2 to 3 weeks. And it's rare that anybody will say, "No, I want your nasty herbs."
Okay, so I have a question that came up about what you're saying, and it's Rhonda, so that you have context for it, because she's in pain and needs acupuncture.
Right.
So she's saying, are you telling me it's not necessarily a fix, just a reset? And I'm like, no, he can totally get you out of pain 100% with the needles. Like, no, it's like a magic thing.
I'm okay with the needles.
But why that happened and why it keeps happening, that we would nourish and fill and fix and patch and repair and tell your body what to do with the herbs to fix it long term. If it's a one-time thing, then it's fine. Like, let's just get you out of the pain. But if it keeps happening, something else is going on.
Yeah, it's so funny, and I think I get a lot of externs from East West College, and now I just recently went through the process to be an externship for Dragon Rises out of Gainesville, and I'm hoping that we get 1 or 2 people from there over the years. But most of our acupuncture interns come from East West College in Sarasota, and I call them magic tricks, but some of the more advanced techniques is about channel palpation and looking for channel affiliation to what is wrong. And so sometimes you have too much energy in one channel and not enough in the other. And when you palpate it, you touch it, you go, oh my God, I can totally see that. And so we can correct that with acupuncture and sometimes just with acupressure. I got fun tricks I can do. But the reality is then sometimes we have to use exercise therapy, and that can be physical therapy. That can be things I come up with.
There's a question coming up that you're gonna talk about that in a minute.
And so if we can understand why there's an imbalance in the channels or in the body, a muscular imbalance, then we can hopefully find the right exercises to provide somebody the control that they can start to correct the issue on their own. And that's what physical therapists do. They're trying to give you, they're walking you through exercises, strengthening exercises, stretching exercises to create a physical balance in the body so that you don't have a particular issue anymore.
And I want to just say real quick, because it was Rhonda that added in that question, was that I have a feeling, without giving away too much of your personal information, I have a feeling one of your channels was interrupted with the process that you had going on, and Bob's going to just figure out how to uninterrupt it.
That's the hope.
Yeah, and if it was a physical item, then we're going to use plants to fix it as well. Yeah. And so that's how we'll look at it for sure.
Yeah, and I did see, and I want to say this, Brett, I know nobody should be breaking the skin without proper training.
The question was, and I was about to say to Bob, like, let's do it. The question was, can we use the ear seeds that are actually the puncture needles if you don't have proper training? And we're not allowed to legally break skin unless you're trained to legally break skin. And so that's.
And I would say that there's so many subtleties, and the longer I do this, the more I appreciate the subtleties. And breaking the skin is, if you've ever taken class with Renee, I think usually in the very first day of the first class at 101, she was like, breaking and entering.
Yep.
Like,
it's the last choice.
Giving you a glass of water and taking a deep breath should be our primary form of treatment. If I'm putting a sharp object, breaking it through the skin, the risk of infection, the risk of altering the flow of chi and blood, of creating, things like shock, for real, even though it's just this tiny little pinprick, can literally cause people to pass out and bad things happen. So I actually think that for other professions that do the very minimal training on acupuncture, I think is a crime. I think if you're going to put sharp objects in somebody's body, that you should be appropriately trained, and the whole rodeo on that. Nobody would want me doing an appendectomy because I watched a couple of videos online, and I probably could. It can't be that hard.
Bob's really talented. He could do it.
All right.
Okay, you want me to start to
bring it on?
Okay, so you can choose. We're going to have 1, 2, 3, 4, and 5 about spinal cord injury, both Chinese and Western.
Oof.
And so we could go with that because I have so much to say about that.
Oof.
Or we can do healers needing to heal themselves first. Do we have any opinion about that?
Oh, yeah.
Or post-COVID vaccine treatment if people were having harsh
Let me take the healer, because that's
healers needing to heal
and I want to make that
themselves.
short. Obviously,
Sure.
we could spend 2 hours talking about that. In Chinese medicine, we actually say that, it's not, we check the respiration rate or the pulse rate, and we base it on the breath of the practitioner. The assumption is the practitioner is in perfect health. And the reality is, at least here in the United States,
Usually the worst.
most of us got here into this medicine because Western medicine had failed us. That's how I got here. And it's funny. A lot of times you'll hear somebody says, like, I'm not going to go see them. They look really sick and blah, blah, blah. And the reality is they probably should be dead. And the fact that they're alive is a testament to the strength of the medicine that they practice. And so understanding that we are all in the process of trying to find balance in our life, and it doesn't exist. It is this constantly spinning disc, the Tai Chi symbol, the Yin Yang symbol, and it's in constant flux and change and motion. And so we're trying to find the stability and balance within that through our controlling our emotions through meditation, and by doing a variety of different forms of exercise, of eating the rainbow of food. But we got history, we got baggage. And so, my knee was operated on as a kid. I've injured myself over the years. And so some of those may not be cannot be perfectly corrected. So I will always be ever so slightly out of balance. Yesterday, I had a bad day, and it was because I enjoyed an ice cream bar. It was super yummy, and it was a healthy one. And so, I'm human. And so I would say, yes, we should, as a healer, be working on our own healing, but I don't think that is there's no end point in that. We should, every day that we're above ground, we should be healing ourselves. And it will take many lifetimes to get there.
Tell me when you're ready.
I'm ready.
Okay, so
I like the COVID.
do you want COVID? Okay, so COVID vaccine care post.
Yeah.
And so Chinese and Western approaches to dealing with the differences we're getting. Some people not feeling anything. Some people like rocking 2 weeks of being very, very sick. In some case, one person having an allergy to it that we know of, and how we handled it. And
I'm going to spare us the vaccine argument, pro or con.
That's irrelevant.
Yeah.
How do we care for our people?
But the majority of people are getting the vaccine, and I think that's a positive thing. The reality is, just like Renee said, we're getting such a range of side effects, and I'm gonna follow the Chinese a little bit on this one, because we talk about illness of catching a cold as something that goes through the skin, the ghost gates that are kind of reside in our neck and the back of our head, the occiput area, and that the wind invades. But the reality is we have other things that when we get exposed to things that are really cold, when you get surgery and you have this weird post-surgical pain that's really cold, even though you're healed as far as the Western medicine is concerned, yet you still have this undefinable pain. And vaccines are, whether it's a live virus or an RNA, it doesn't matter. They're injecting something through the skin. So for us, it's a type of wind invasion. And the strength of your immune system determines how strong a reaction. And I'm going to come back around a little bit. So from a Chinese perspective, it is a type of wind cold invasion. And so I find using gentle, warming, diaphoretic herbs can be helpful. And that's the release exterior. So something like a guirjeton. Some people are using, and I would say judge it on the individual. You can also use Yin Chao Jade Pian. But I would also suggest, because we are seeing this range of severity and the isolated cases of more autoimmune kind of responses, is making sure that your immune system is functioning well prior to going in there. And I would say that's the importance of vitamin D levels. Anyone with darker skin or like me who works inside way too much. And so we're not getting enough sunlight. And so to have a vitamin D level, I would say a minimum of above 50 is an important part of a healthy immune system. Also, we can use vitamin C pre and post. And I would argue that zinc is a supplement. If you were looking for specific formulas, you could use Yuping Fen Song leading up to your immunization. Yuping Feng. Sorry, hard to talk and type. Yuping Feng. Oops. Feng. Which is a combination of Feng Feng, Huang Qi, and Baizhu. That's Siler root, astragalus, and atractylose.
Pulled that out of your butt.
That's right.
Siler root. Good job.
Nice. There's other names for it, but that's the one that's in my head.
I want to add in that Lily is saying that, because she's in the midst of her nursing school, right?
Oh, yeah.
Lily is saying that her professor is a super huge fan of the battlefield points, the battleground points. Yeah. And yeah, like absolutely really positively. Like, I'm like, and I said, Lily, that's what we taught, that's the NADA protocol and what we taught you.
Battlefield's I
know it's a little different, but I'm saying this is what we did in class. Like, she actually knows it. And so she should feel very accomplished in class that she knows what she's talking about and can do it.
So I think there's also, looking at that post-COVID reaction, some reaction is actually good. That shows that your immune system is responding. I think that if you have no response, I would be concerned, actually. I would like at least some soreness, some fatigue. I want some sort of response. We don't need you, missing work for a week, but your body's immune system creates inflammation if it's activating to attack and create the antibodies. So if you're not seeing any reaction, I might go in after your second shot, or if you're doing the J&J, after your first, after about 2 months, and make sure you've got some antibodies, because it may be that something else needs to happen with that. All right, what else you got?
Okay, so many things. Okay, do we want to deal with the spinal cord stuff first, or do we want to go to something else? I have a whole bunch of...
That one might be long, so...
SSRI, herbs that are safe from a TCM depleted standpoint for people who are on benzos and SSRIs. And that comes with 3 more questions of post-sex back pain points from the same kind of person. And there's yet another question about Paracelsus with a deficient GI of the same person because of too much cleansing, thinking they have parasite issues. So they're getting more back pain from the deficiency after ejaculation than average because they're so deficient. Paracelsus isn't working, and the SSRIs, he's now depressed. Like, it's all the same thing we know, but we have to figure out how to back ourselves out of that.
There's a lot there, and I hate to say it, I'm not going to get too specific, because without seeing the human, it's really hard to, like, don't take this as a recommendation for an individual.
I've seen the human.
Yeah,
so
I know,
but
no, it is important that we're giving some very general advice to this. If somebody has a specific issue, they should have their client or their friend or themselves to come in for a proper intake. But when we're looking at herbs with SSRIs, depression is not a single thing, especially in Chinese medicine. It can come from anything from qi or blood deficiency to qi stagnation to even blood stagnation. And so our approaches to each of those will be very different. And I'm going to say generically, Free and Easy Wanderer Plus is like, we handed out like candy canes.
Good answer. That's a good one.
And I have not seen, and that's Jiawei Shayuan, and there's a number of different companies have different versions of it. They're all pretty good. The reality is, what is its role? How does it affect an SSRI? And nobody really knows. That's my short answer. The only plant that we actually know has a specific contraindication, and the contraindication isn't that you're going to fall over and die from it. It just means that your SSRI may work too well and you'll get a side effect, or not well enough, and that's not even well understood. That's St. John's wort. So everything other than that, I find that if we start at a very low dosage and about every 2 weeks increase your dosage, and watch for side effects. And that's for SSRIs.
So even something like a passion, like we're coached not to use passion with SSRIs.
Yeah, whatever.
You think that as long as we're doing it a tiny bit at a time, we can start to move everything? I'm telling you, this is it's deficiency.
And I would tell people to don't use herbs that are considered anxiolytic antidepressants with antidepressants. But
that's what I'm saying.
The reality is, go to a kava bar and watch everybody throw back massive amounts of that.
And not have a care.
Most of those people are heavily medicated. And the reality is, when having done this, I won't even take a guess at how many tens of thousands of patients I've seen over the years. I ain't never seen a herb-drug interaction. I've seen me do a bad job with herbs and have a reaction that people, poop themselves or something. But the reality is that if we are looking at the energetics of the individual, if we're doing a thorough intake and basing our formulation on that energetic intake, and then starting at a subclinical dosage and monitor for any kind of adverse reaction, I ain't never seen an issue. And so
it's a valid answer. So for the practitioner that's asking.
Yeah, and so
they're super
cautious.
Safe. Yeah.
Benzodiazepines are different.
Mm-hmm.
Those are dangerous. And so stopping those cold turkey is dangerous, as well as interfering or increasing the absorption of those. So decreasing or increasing the absorption of those is a whole nother animal. And I would say, like, cold turkey off of benzos can kill you. That should almost be done in a hospital setting. That said, I know people who have done it, and they didn't have a good time doing it.
But
and in the same way, when we're looking at benzodiazepines, we're looking at anxiety disorders oftentimes. And so and again, every book will tell you don't do any anxiolytic, any anxiety herbs with anxiolytic medications. If I do it based on the diagnostics, the tongue, the pulse, and a thorough intake, again, low and slow is my mantra for that. And it will either work or it won't, but I have not seen bad things happen.
I want to tell you,
it's only when we start to use nutraceuticals.
The practitioner that sent it said, and I know Bob's going to roll his eyes when you read this. That's how well they know us.
That's nice.
So I'm just saying.
All right, what else you got?
Okay, so we can do...
we didn't go back pain.
We can do...
So I
it's
missed...
the same kind of...
Yeah, I know. But no, I think that's it's a fascinating question.
They want to really be able to, at the time, grab the foot points and pull that energy back down.
So the idea that there is back pain with orgasm, and I don't know that Western medicine necessarily goes into that level of nuance, but in Chinese medicine, that's a very classical kind of idea. The male loss of essence of Jing through the ejaculate has a direct reflection on low back pain, weak knees, what we would call a kidney qi deficiency. And I've seen a number of cases of that. So like doing an acupressure point, sure, but...
And it's somebody who's skilled.
Yeah, I would say you can build them up through herbs so that doesn't happen, and monitoring how often they actually orgasm.
And they know to do that?
Okay. But I'm
working on that?
I want to educate everybody on these. So
it's a new relationship.
Okay. So there's a number of different formulas that can be utilized for that. And so it's important to recognize these are nourishing formulas that you would use specific for the kidney health, not those herbs that we might look at for sexual tonics, because that can have a detrimental effect. So we want to look at those strengthening the kidney energy in the low backs. Kidney 3 might help. Ren 4 or 6 might help, acupressure. And UB23 do 4 on the back might help. I'd put my money on Rent 4 and 6, actually.
Good job.
I think that would be the most likely because that's more about nourishing the essence and Jing.
Okay, you good with that?
Yep.
Okay. Now, in somebody that's heavy, and you can choose. We can go to, I have a thyroid diabetes one. We can go to peristalsis.
Yeah, just give me one.
Peristalsis and deficient GI after too many years of cleansing, thinking they have parasites. Are there any herbs that you know of that would reinstate or help to reinstate proper peristalsis? And this is from somebody both Chinese and Western trained.
Oh, okay.
And so they would do Chinese all the way,
so
if they could.
It is super hard, and there's a learning curve with that. The body literally.
I said it was a hard one.
Yeah, from over cleansing and so forth. Without a doubt, we can lose the tonicity of the bowels, and that's a scary thing. And there's definitely certain Chinese herbs that are helpful for that. Mushang, Aucklandia root.
Can you spell that?
Muxiang. And there's actually 2 different species that are used, but it doesn't matter. Also, Jershur, which is not gardenia. Jershur is bergamot. Zhishi, I think.
I'm proud of myself because I was starting to write it.
Yeah. And obviously not those by themselves, but in formula.
And they know. Yeah.
And the other one to look at is St. John's wort.
Nice.
Because it's important to recognize, like for irritable bowel syndrome, frequently antidepressants are prescribed, and not because they think you're depressed. It's because something like 90% of the serotonin is produced in the gut, and that serotonin has a role in that gut motility, the peristalsis of the intestines. I would say abdominal massage can also be helpful. And of course, just good nourishment.
Yeah.
Looking at soups and stews, bone broth. And it's funny, I've been experimenting on Renee.
I've been taking it like a champ.
It's really fun. I really enjoy mixing East and West a lot. And one of the things that we look at is leaky gut, anything from over cleansing to overuse of antibiotics to NSAIDs and so forth. And so I went down some rabbit holes and was looking at some of the function of L-lysine, one of our amino acids. And everybody thinks about L-lysine and its role for the suppression of the herpes virus, and so we give it to folks with oral, genital, or even shingles. It can be really helpful in shortening the length of an outbreak. And I knew from some other use, dumb luck and a longer story I'll spare you all with, the idea of using it for collagen production, and I'd seen some good use specifically with dyshydrotic eczema in fairly high doses. And so I was reading about this literally just like a week ago, and it was talking about its use specifically in generating lung tissue and improving both the continuity of the lungs for things like COPD, and the dosing they were using was way higher than any of us would ever do on anybody. So I always like to mix the two. And so I see the connection between lung and large intestine. I see that when people have lung issues or sinus issues, they oftentimes have gut issues. And so my thought is, I wonder if this has a role that maybe isn't as well researched, or I didn't read, specifically about the health of the gut to help with that leaky gut permeability issue, and ultimately that may help with the peristalsis that we see with that as well. There's also some conjecture that bitters, I mean, we always talk about bitters for the gallbladder, but using some of the huangs, those things that contain berberine, some of the yellows, may cause some contraction. And I've also seen, not always in a good way, but it does work, is something like cayenne pepper. And so the spasm that gets caused by that would start to recreate the tone. So small amounts of it would cause some, maybe not the controlled peristalsis that we want, but if we're looking at getting the tonicity back in those in the intestines.
I went the weird leaky gut route of, if things are going through a non-toned area, what do we do to cure that, to start to bring that rigidity back to
And
that?
things like red raspberry.
Calendula and burdock even, because the mast cell, like redoing the signaling of that.
Oh, I bought a bunch of burdock for tomorrow.
There's several things like that I was like, we went that route first.
If you want to be a freak, oak, red raspberry, blackberry.
Yeah, but I don't want to.
Strawberry leaf.
Yeah. Okay. All right.
So there's options.
Yeah.
Okay. And you know, of course, you know, if it's loose stools, blah blah blah, then we start to look at those things like Shenling Baizutong. If we're looking at Chinese, it just kind of depends on how it shows up.
So just because this adds into it, because it says speaking of bowels, when is it okay to use a colonic, and when is that a great idea, versus the negative results of affecting like Paracelsus, like once a year, is that okay? You know, we do know lots of people who we probably would judge as over. We see that happen.
So I think the overuse of colonics is bad. And you know, a hydrocolon therapist probably would have different opinions. I a lot of times when there's like debate like that, I go back to what's traditions say, and we can look at a lot of different cultures. Ayurvedic is some purging, cleansing fools, but if we, you know, they'll purge every orifice and stick a garden hose in it. But if we start to look at some of the other traditional cultures, especially in the Americas, we look at seasonal cleanses, and they're oftentimes, it's funny, and we can use Florida, cleanse was the black drink. And so it caused vomiting and diarrhea oftentimes, and it was done in a ceremonial kind of process. We see sweat lodge in a lot of traditions in Olympia, but that was oftentimes along with fasting, with sweat, and may or may not have had some sort of purgative antiparasitic that was a part of that as well. And so I tend to move in that direction. When somebody says, I've got parasites, and they need to cleanse for months on end, there's a problem. I think that if you're eating cooked food, if you're don't have a pet, you're not eating dirt on a regular basis, you probably don't have a parasite. A lot of times, the people who think they have parasites because their butt itches and things like that, and have digestive issues, it's usually because they're having too much fruit, and the parasite is actually something like Candida. That they've gotten a dysbiosis, a gut imbalance. And I've seen way too many cases, more in the last 2 or 3 years, of low stomach acid, either caused by things like aging, or from the overuse of antacids, or, I hate to say it, alkalized water. And that's a real issue. You're supposed to have an acidic stomach. And if we alkalize it, we throw off the acid protects us from yeast, bacteria, viruses, and fungus, and it helps to break down our food. So we can create part of that dysbiosis or potentiate the wrong critters in our gut by alkalizing our stomach. So, and if you're an acupuncturist and going to the Fasoma conference, I'm going to be talking about that.
I need to answer something. So Kristen wrote up that Aviva and Guido say that lysine can cause arteriosclerosis. So hold on. I do have something to say about this. Okay, so Kristen in particular, but anybody who was curious about that, So L-lysine is one of the things in our body that can control where our calcium goes. So it helps to distribute where our calcium goes. So asked backwards, you could say L-lysine could cause plaque to build up, cholesterol, gallstones, kidney stones. But the fact of the matter is, if that body didn't have severe inflammation to begin with, that's not where it would go. That our cholesterol goes to places to protect us from inflammation, so it wouldn't matter. Like, so if you were healthy and you just needed the use of that for this one extra thing, it wouldn't go to that spot. So really, it's the inflammation in that person that's the issue, not the L-lysine. If you do too much of anything, there's going to be a problem. But the fact of the matter is, because it controls the distribution of our minerals, if an extra mineral fatty deposit goes to a place of inflammation, it's not the L-lysine causing it, it's your fat that's causing it.
And I have had
inflammation.
I have had a number of.
It's not wrong.
I've had. It's not common. L-lysine, like Renee said, is not the cause. But I also have people that are doing excessive amounts of calcium. Either their doctor or nurse told them to take more Tums, or they're taking multiple supplements, all with lots of calcium in there. And I want to say the research shows that if you get more than 2,500 milligrams of total calcium, supplements and dietary, that it actually causes heart disease. And so it is the excessive we have a fascination with certain nutrients, calcium being one of them. Most of our diets are not depleted of calcium. There's lots of calcium in vegetables and other things.
And the other thing is that if you go to, and I'm answering Kristen's thing specifically because we know both Aviva and Guido and respect them. But if you go to any of the heart doctors and you ask, do I need something for heart health? L-lysine is on the list. So if it was causing hardening of the arteries, they wouldn't have that on the list. And so it's really chicken or the egg and how you're being responded to.
Yeah.
And so too much of that's my point is too much calcium.
I have not seen that. I know I have.
In laboratory rats,
I've read that,
but that's it.
And I want to say the research that I've just read, and this is a ridiculous dosage, and it wasn't rats. And most of the things people quote these are rat studies.
This one is a rat study. I've read it.
Yeah, and the one I read about using it for lung tissue, it was a 0.5 gram per kilo of body weight.
Which, Kristen, we figured out was me taking the entire bottle in one day.
Yeah, basically.
So that was the dosage that I could max up to, the whole bottle in one day.
So it is, one of the things we try to tell our students, because whether it's Mercola or Guido, like they're great researchers, but they oftentimes will literally make these very powerful statements based on a 3-hamster study. And not on clinical experience or on large-scale human studies, which there aren't a lot on supplements. And some of the few are things like calcium and magnesium, usually not something as obscure as L-lysine, which is a naturally occurring amino acid.
And I would tell you that you would not have any doctor, any pulmonary doctor, trying to send you to L-lysine for lung tissue, because that pulmonary artery having water inflammation in the pericardium, push it one way or the other, is a huge issue. That if they thought for any reason that there's inflammation in the heart or in the arteries, they would never be using it for lung tissue. And it's very precise and specific, because I think that Bob's a crazy Yahoo, and I'm not going to just take anything that he gives me. So of course, what I did is I totally would. I went home and immediately said, what could I tried to find PubMed studies on. How could I max this out? What is the worst thing that could happen? Could I eat this whole entire bottle? And in very all over the world studies, it comes up with I would need to eat the whole bottle every single day for a year.
So what Renee said is I told her something. I was like, here, it's a bottle of lysine. Let's see what happens. Mm-hmm. And she went to PubMed. So she looked for original sources. And that's what's important that we do, is find the original research and see whether it has validity. And admittedly, some research can be challenging to sort through. Practice makes perfect on that. The more you read the gibberish, even if it's just the summaries, it can give you a real insight into the kind of leaps of faith and practice that people make literally on very limited information. And I'm as guilty of that as the next person, that I don't check sources sometimes when when it sounds good, and I tend to only question the sources when it seems it doesn't make good common sense. And so then I start checking a little bit harder. But I probably, there's a lot of things we do in medical practices, not just crazy alternative world, that everybody's always done it, and yet it has no validity and no research to back it up. And probably shouldn't be done. And so some of it's very cultural specific. Things that we do in the United States aren't done in other countries. And so it's always important. Like we say it all the time, question us, question everybody.
Because we want to know the right answer too. So if you guys come up with some great, brilliant science we don't know about, we want to know too. We just only want people to be well. So we don't mind being wrong. We just want to be well.
What else we got?
Oh my gosh, so much.
I know.
Okay, so here's and you can choose. Do we want to talk about, does a sluggish thyroid relate to diabetes or vice versa? I know my answer on that. We have the spinal cord thing to go over. But then I don't know if you know anything, because I do have a lot to say about this, about chemotherapy, of using the embryonic states or the buds of the plants to make medicine, thinking that they have special enzymes or that they have special, it's tantamount to me to eating like sprouts, broccoli sprouts. Are you eating 450 broccoli plants and getting that? And so I do slightly have a thought on this that I could babble on about, but do you have anything to say about chemotherapy?
I don't actually. And
I'm happy to babble about it for a minute.
I'm familiar with it, and I don't tell people not to do it. It makes sense to me, but I haven't looked at the research on it.
Okay, so let's talk real quick about that if you want to.
Yeah.
So I can talk real quick about that. Okay, so I do have something to say about that slightly. One of the things that I speak about a lot is, if you had no electricity, could you still have your food and could you still have your medicine, and was it still available to you in some way? And this is important to me because I don't want any government agency, I don't want a king, a queen, a person in your community controlling your medicine. So my first thing is, if you go back to the original source before it was called chemotherapy, how we would have done that, it's valid. Like when you think about it, it's valid. So let me give you an example. And I would have learned this like good old farm girl, but it's very Druid Celtic. It's very Cherokee. The act of pulling a certain bud off, because when you did, you had this special resin that only came when the buds were coming, things like that. Like the first blood, it's called the first blood, that's the maple syrup that comes first at a certain time. We have a friend who lives in South America who's indigenous person, who showed us that just this tiny bit of the top of this plant, when we break that off, it's like intoxicating and very special, but the rest of it we're never supposed to use. Only the bud, when it's sprouting, is the thing that we would use. And so this comes across in everyday medicine all of the time. Also, the thought that there would be special hormones or special things going on in that plant at that time to generate that new bud also is like, hey, are we generating new back tissue, almost like stem cells in the plant?
The broccoli sprouts for the dim to help remove
broccoli sprouts for dim. So my point is, we're already doing this without some fancy name, that we would definitely think that the powerhouse, like almost like a stem cell thing in a human to regenerate, well, are we using those tiny little cells that are making a whole brand new plant? Yeah, like I can imagine that being just an crazy successful treatment. But then the secondary side of that is, we're doing that, just nobody gave it a fancy name. So Kristen in particular, but then Babsy backed it up. Like we have in our Medica now, only this, like the pussy willow top buds, or only harvesting at this time. If your grower can't tell you that, then don't take it. And so we already do that kind of. I think it's very valid.
And I would throw in there that there is a tradition to that. Like we talk about, and it's funny. I'm just like, and I knew the name, but I'm like, but I don't actually always associate everything with it. This is the time that we would do it. It's the spring greens.
100%.
The ramps are just coming up as you go up north. They like if you're going to make if you're going to eat poke, this is the time that you harvest the greens. No other time. So there is a lot to be said for getting those new sprouts, the young greens, the first blush of leaves as they come out, that there is a very specific time, and that is the springtime.
That's why I said we're already doing that. Almost like the Cherokee and the Gulls on the witch hazel. Like we're already taking things at a certain time to get the full maximum value of it. And so I think that really look to your ancestors and look to the root of your medicine.
What did
and
your
you'll see that
grandmama
happen.
do?
Yeah, you'll see that happening already. But yeah, sure, you can get that maple syrup any of the time, but right before it's about to sprout, if you broke off a twig and started sucking on it, it was going to be like the most heightened sap and syrup. The other thing I'll point out about it, it generally falls around a sap or something specific, so that you're really only looking at it at that time. Well, of course, we know from like harvesting by the moon that all the stuff would be up in the top of that tree making this new plant go. And so that would follow other ancestral conditions that we know to follow.
Do you know a source for that? I don't.
No,
I know I've seen books, but I don't know.
No, because I'm telling you, it's just been given a fancy name. Like it's harvesting by the moon is what it is.
There's some out there, but nobody I would recommend.
You know what?
Because I don't know. What else we got?
Chris, Wyatt, nice to see you, hon. Yeah, exactly. Just like the poplar bulbs being aromatic, 100%. Kristen, if you personalize a message to me, I'll get you a source. Yeah. Like I know a weirdo to give you.
What else we got?
We have the sluggish thyroid related to diabetes related to sluggish thyroid, like endocrine system disruption, or we have spinal cord injury and different questions about that.
Wait, let's do thyroid just because it's such a common thing, but we've got time. We'll get both in. So, and Renee said it right. Endocrine system disruption. And so whether we're talking about the islets of Langerhans and the pancreas.
And so it's a Chinese practitioner who asked.
Okay. Or the thyroid not doing its job, being too hypo or hyper. I would say it is a endocrine system that's being disrupted. And if we recognize why it's being disrupted, then we can take a more effective approach. And so, certainly diet has a huge impact on diabetes, on pancreatic function, and I would argue, of course, on the thyroid as well. But too often we forget the role of stress in that endocrine disruption. And if we're talking about the HPA axis, the hypothalamus pituitary adrenal complex, I would put the thyroid in there as well, and the pancreas, because they are the way they're all working. Also, the role of inflammation, and that goes back to diet, but stress can be that as well. And that just throws a monkey wrench in our body's ability to utilize the signaling, the hormones that it's trying to use to balance things out. Nobody's home. That said, when diabetes as chicken or the egg, which one comes, which one happens first? I see this low grade, they haven't crossed this magic line into over 99 on their fasting blood sugar. They have every symptoms of diabetes. And so as far as I'm concerned, they're diabetic, and it's causing inflammation and insulin resistance throughout the body. And other things, if the individual cells that are accepting the signaling from the thyroid, if all of a sudden they're all inflamed because there's too much blood sugar bebopping around and the body's struggling, what other things, what other nutrients, what other signaling hormones are not being utilized properly by the body? And so I would say we hyper-focus on this blood glucose level, when the reality is we should just look at their diet and the symptoms patterns that are arising and factor in if their blood sugar is high. But I find that people are 99, 98, they're diabetic as far as I'm concerned. And I try to convince them and I treat them as if they're diabetic and that they should change their diet and lifestyle as if they were. And that oftentimes helps to resolve that low-grade hypo or even hyperthyroid.
I feel like this is such an important thing for us to think about, what Bob just said. We always tell everybody to bring their blood work to us because we look at it so differently that the parameters they have for all of us have changed and shifted as we've become unhealthy. They've gotten more laxed. And so we look at it like, if you're marching that way, why wouldn't we just pull you back versus somebody's normal might be completely different. So if you see it rising, there's an issue. But if you've been that way for 20 years, maybe not so much. So we look at you as a whole picture. And so I'm in agreement with that. If we see it even moving towards that a little, we would think there's an overall endocrine system disruption that we need to come back into balance with. Are you addressing the crazy that you're seeing walking back and forth? Is that why you're laughing?
Oh, no. Yeah. For anybody just joining us, we're getting ready for Herb Day. So all of this randomness walking back and forth with Ruthie was not wearing a grass skirt as she walked by.
I love it. It's super good.
And Wyatt, that was not me kissing you all over your face. That was Renee using my sign in.
You like that, did you? That Bob was kissing him all over his face? I miss Wyatt so much.
So
spoke about Wyatt yesterday.
But I will say, and I'm not as quite conspiracy minded as Renee is. It's important to recognize what blood work is. Blood work looks at the averages of people who go in and get their blood tested. And because over time, those values will change. But one of the things that I remember what class I was in at some point or another, but somebody was like, the only people who go to doctors really are sick people.
Yeah, and so
our average is based on sick people, not well people.
And that's why it keeps getting worse.
If we forced all the healthy, perfect people to go in and get annual blood work, we might see those what would be considered appropriate or normal very different, because we're literally averaging all the sick people together. So I feel like it is important to look at those ideal or functional values rather than the you're screwed, now you need medication values, which is what the MDs are looking at.
Okay, so there's an add-on question for that. That's what you're seeing over there. So it says, aside from the diabetes, what is the TCM or Western version of why you would wake up just thirsty all of the time when you've done your blood work, you've done your mineral panels, you drink water, and you're still waking up thirsty throughout the day. You're drinking, but you're still thirsty, and everything looks right according to medical. Can you account for that at all?
Yeah, and let me. Owen's been here before.
Yeah, 100%. Like, we get a lot of good questions from them.
So. In Chinese medicine, if you go and you look in your textbooks and so forth, it'll all say that hypothyroid is kidney yang deficiency, and diabetes is liver kidney yin deficiency. Actually, it could be a couple different ones, but it's always a yin deficiency. And I'm here to tell you, I have never seen a kidney yang deficiency hypothyroid. I would say there are many different reasons I've seen the thyroid tank, the majority of which is liver qi stagnation, that it causes a dysregulation of the thyroid more so than a failure of it to act.
Okay, so I'm going to prompt you in a different way to help other people. So what does liver qi stagnation look like in the Western world?
Stress.
Okay, so stress.
So long-term stress.
Adrenal fatigue, even.
Yeah, you could argue adrenal fatigue. That could go a number of directions, to include kidney yang deficiency.
Okay.
And diabetes. It's funny. So diabetes in Chinese medicine is some sort of a deficiency heat, yin deficiency, and we might see it in the lung. We might see it in the kidney, and we might see it in the liver. Did I say stomach? I don't know. Yeah, I think I did.
When Bob says spleen to the Western people, it's digestion, like stomach. Just letting you know.
And so that thirst, and so when we look at key indicators of diabetes in Western medicine, we look at increased urination, more so than if you were, for the amount of water you're drinking, increased thirst, and those can kind of lead you down that pathway. And so that increase in thirst that you're seeing from a Chinese perspective is not, we would certainly ask the question about sugar intake and blood sugar values and so forth. But it could be anything from certain autoimmune disorders to, I would say, stomach heat. And so there could be a dysbiosis where it was a dry, hot terrain. It could be a stomach yin deficiency. And the fact that it's happening, and I'm sorry, I only read snippets of this as Renee does it. The fact that it's happening more at night would move it, according to Chinese medicine, more into that yin deficiency realm rather than thirsty all the time. So if it's nighttime, first thing in the morning, waking up with that dry mouth, increased thirst, that might actually fit that bill. And so that isn't limited to diabetes. And I think that's important that, if they are diabetic, then yeah, we got to address that and use cooling, nourishing, moistening, all of those things that might be in there. And Renee tried to point something at me, and I'm not sure what it was, but I'll figure it out. And one of the things I always say, and I'm sorry I don't have the ability to write all of this out. It's a good chalkboard, dry erase board thing when I do it. That how do we get from poor diet to a yin deficiency pattern in Chinese medicine? And so as we poor diet will lead to a qi deficiency, and ultimately that leads to phlegm. Phlegm leads to heat. The heat consumes the yin, and the next thing we have, and that's over 20, 30, 40 years. And so the reality is we don't just have yin deficiency. We actually have all of the, we have the qi deficiency, we have the phlegm, we have the excess heat. All of those will be there in varying degrees. And so we have to peel those, we have to go back through those disorders, and our formulas will oftentimes try to address each of those with the focus on the yin deficiency. And of course, if we know herbs have been researched to see that. And Xiao Ke is, we'll see, Xiao Ke is the Chinese way of talking about diabetes. And so we'll see formulas called Xiaokuwan, diabetes formula. And when you look at that, you don't always recognize, like, why do they have Shigao, that's selenite in there? And it's like, because at some point there was an excess heat. Why is there astragalus in there and Baiju? Those are dry nerves. And we said there's yin deficiency. It's because there's qi deficiency.
I just want to point out, when you talk about, Bob grew up in the islands, if you guys didn't know that, you talk about those women saying, "Oh, you just need to cool your blood."
Right, the bitter melon. It's used to kill. That's to clear the excess heat because it's a dry nerve. But we have to add other things in the mallow family, perhaps something like okra can be added to that.
That's
so,
cross-culture talk, right?
Yeah, it's definitely, we have to make sure that we're addressing not just the acute diabetes, blood sugar elevated, yada yada, but all of those things that led to that diabetes, and ultimately diet and exercise, of course. And you were trying to point at something. Were you trying to point at the spinal cordy stuff?
I was going to say, we have somebody asking, do you know anything about Nature's Sunshine products, bad or good or whatever? And then we'll do spinal cord.
I don't know a lot about Nature's Sunshine. People do bring in their products. I think they're not evil. I've never recommended any of their products. As a practitioner, we can get way better products than that. And there's a lot of, if I remember correctly, there's a lot of synthetic versions of some of them, and a lot of fillers, binders, and lubricants that I'm not a fan of. Some of their products are okay, where I'm like, that's all right, you can keep taking that. And other ones I'm like, yeah, that's not so great. And that's a personal opinion.
Okay. And so what we have for questions now are going to be
hard.
No, it's not. I have a lot to say about it, and I will do better than what's written there.
Okay, well, give me the lowdown.
So it was Chinese and Western, asking for Chinese and Western. So it's, have we seen any success with helping acupuncture or herbs with any kind of injury that's spinal cord related? And the context was whether, well, I want to talk about it personally for a reason that's obviously near and dear to my heart, because I want to argue something. So it says, what are some herbs that can be used for a spinal cord injury? Upper body weakness, lower body weakness, all over atrophy. Is it better to get acupuncture instead? Have you ever seen somebody restore to function? So can I say something about this?
Go for it. Eat my sandwich.
We will, and there's there's anything to choose from in there. And so let's talk a little bit, and we'll get Bob to comment on this. So clearly we have a clinic. We're here. We clearly have a massive eclecticness in that we are definitely Chinese and Western slanted, but we're both traditional healers and we're both consummate nerds, and we study, and go to overeducation and go to, here, Biella, no, trust me, you want it, and go to all kinds of different eclectic, ancestral, modern science. And so here, what you guys don't know is about a year ago, just a couple weeks short of a year ago, I had a spinal cord injury. Now, I've had my back broken twice and my neck broken once. I've had more than 10 concussions. I've had my orbitals broken and so much damage that I've been blind. I have MS lesions. I have ruptured discs. And my point is, forget spinal cord injury. I'm already a mess. And have pulled myself out of that with herbs alone until Bob. And have done a great job with people like Matt Woods and Jim McDonald in particular, coaching me through some really old Blackfoot type of traditional medicine that's not really written about, and something that, like one of those occasions where he's like, the plant told me to do this, so go do this. And I'm like, okay, because I don't want to be paralyzed. So this newest injury was my spinal cord protruding out the side of one of the old injuries, and then a piece of disc coming off and getting lodged next to it. So immediately I had one side completely paralyzed, couldn't use it at all, the worst pain I'd ever been in my life, numbness, cognitive dysfunction, like basically anywhere that it was impeding, it was not working. Nothing was working on that side, and had to work this whole entire year because it was the week that we got shut down for COVID. So they wanted to take me to surgery. I had decided I was going to go to surgery, and they said, because it was just, if they were saying to me, if we don't get this spinal cord back in correctly, it's going to be permanently injured and you will never retrieve these functions. This is what they said to me. And so I decided I wanted to go ahead and go to one stage of this, scheduled it, and the next day the whole entire surgical team had COVID and shut down. And so it's one of those things where I do believe in divine intervention. And each time I decided to go against what I thought was going to happen, because I was so upset because I thought I was going to be paralyzed, that there was an intervention that kept me from it. And it was frustrating and it was upsetting, and it was one of the worst years of my life, and I'm still trying to regain my function from it. But what I'm saying to you is, we're doing it. It's working. And every time I go to the neurologist and go to the neurosurgeon and go to the orthopeds, they're like, y'all are crazy. Like, I don't know what you're doing, but you walked in here without your crutches, or you walked in here without this, or how did you do that? And 100%, it's because if I overwork, the acupuncture sets me back, and the herbs are picking my ass back up. And so, yes, we have very precise and specific herbs that go against what we're ever supposed to tell y'all about regenerating tissue or healing a disc that's supposed to be impossible, or anything that's like that. So it's very important to understand that the possibilities are there, even if the science isn't. And the reason why we spout off nonsense about some of it is because we've seen it work. If you do it 100 times and it works, I don't care if it's not written in a book. So that being said, Bob, what are herbs we can use to help with a spinal cord injury?
So, it's oftentimes it's spine versus spinal cord. And spinal cord is definitely the harder animal to try to adjust, because that's actually that nerve bundle that's communicating versus the disc or protrusion pushing against a nerve coming off, anything that can happen to the spine itself. So recognizing the difference between the spinal cord and the spine, a bone and some cartilagey stuff. And for the spinal cord, it's funny, we've had, they do spinal taps and things like that, where they suck off some of those cerebral spinal fluid. We've had a couple of cases over the years where it didn't seal up. It didn't stop leaking out after they got the juice out. And it causes some pretty serious and potentially life-threatening things. And I guess Western medicine doesn't have a lot of things for that. They basically slapped a Band-Aid on it and sent them home. And they came to see us after it had been leaking out for weeks. And so there's herbs that can help to stop the damage itself. Things like the Tian Chi in particular. You could probably work with shepherd's purse, we've got our local one here, the soldier's button. That's a version of that, and maybe even the pepper grass, because that has a stop bleeding effect too, and so that cauterizing. But if we're looking at like a spinal cord that's been damaged or crushed, say from a car accident or a bad fall, it gets harder, and so a lot of it's going to come down to why. If is it a stroke? Is it a crush fracture and so forth? And I think there are limits to it all. But we can recognize the idea of trauma, and I'll go with that as a premise. The idea of chi and blood stagnation. So recognizing that even if the pain and bruise is gone, there may be a congestion of blood and chi that needs to be invigorated and moved out. But then the damage and the atrophy is usually a yin deficiency, and ultimately nourishing the blood and chi to try to regenerate it. The sooner you start to address it, the easier it is. Once, years have gone by, scar tissue is formed, your results are going to be limited with herbs or acupuncture.
But what I want to tell you about that, and it's maybe just because our practitioners are magic, I don't know, that I've run into some, like, obviously some things have happened, and I know my limitations a year out, but I've run into other injuries because of it. And each time we come up against a wall, that if the acupuncture can get in there, if we can get blood to that area, if we can break up some of that scar tissue, and then I get right back on the herbs again, it seems to start to work and push it out. Like, it's amazing.
Cord versus spine and nerve roots. And so
I know, but like the impingement on that side, like my numbness still comes back.
But that's different. That's not the cord. That's not a cord injury. And so I would say herbs to look at might be things like serapeptase. It's not an herb, but it's a supplement. For the nourishing aspect, and it's funny because we start to see this when we start to look at the spinal column as well, is things like the Huangjing Solomon seal, the mullins, the mullein stalk and root, and then in the earlier stages we can use things like the Gu Sui Bu. I like to call it blue suede shoes, but that's just me. And Gotu Kola, we've started to play more and more with Gotu Kola. We usually think of it like, oh, it make me smarter, eat Gotu Kola. A powerful Ayurvedic herb. It's also used in Chinese medicine. That's in your Medica book for Chinese medicine. Look up Centella Asiatica. But when we start to expand our thought process with it, not only does it seem to work specifically for the ability to form thoughts in the brain, it's an anti-inflammatory and specific for connective tissue. And so we've had some really good success with that, in particular with autism.
Add that black cohosh in there too.
But also if we're looking at some of that connective tissue around the spine, and of course the oats, the milky oats, having that generalized nerve function, the lion's mane. So if we're talking cord, a lot of the things that we might use for the brain, might be the approach, but a lot of it's going to depend on how the cord was damaged and how long ago the cord was damaged. From an acupuncture standpoint, we're looking at Jing. And if we go back to our, year one kind of theory in school, day one in herb school, that idea that as the Jing develops, that it fills the marrow of the bones, the spinal cord, and then it creates the sea of marrow of the brain. So if we're looking at that, we're going to do acupuncture specific, looking at some of the Ren points, the Dufour on the back. But there's also Qigong exercises that are specific for, we call it marrow washing.
Oh, that's an amazing term.
And I would say to start those exercises, even if somebody is a paraplegic, I think that you can still do so much of that work to try to develop the jing and the marrow to try to assist that. And theoretically, uh, Bruce Lee had his back broken badly. Was told he would never walk. He'd probably never leave the hospital, and he was kicking butt a year later.
He's Bruce Lee, though, dude.
Right. So all of us are Bruce Lee, and so I think it is a matter of our perseverance, our willingness to go down that rabbit hole, and to pull out all the stops from all of that.
Okay.
What else we got?
So we are.
We're rocking it.
Yeah, we are. We can go to the next question if you want. We have 30 minutes, so this is it, you guys. Okay, so have you seen a connection to forceps and deliveries and scoliosis? And I have personally that I not only scoliosis, but some other things that definitely, if we have any trauma at birth, that Kristen, you should know from being around us as much as you are, that one of the questions that people are baffled by is, do you know anything about your birth? And we'll talk to them about all kinds of impending things that come with that. Do you have anything to say about that?
I haven't seen it. Like scoliosis, we can, King Tut had scoliosis, the boy king. Useless things in Bob's brain. He actually had a club foot and a number of other serious deformities. So scoliosis is not a modern issue. It's something that we see through the ages, and I don't think that we clearly know the causes of it. Forceps have an issue, without a doubt, and it's funny, like you don't hear me mention chiropractic care very often. There are chiropractors who specialize in infants and babies delivery.
It's so cute.
And it's important that if you, sorry.
That and cranial sacrum.
I think I snorted some chalk. Sure, it was chalk.
I'll get you a tissue.
Thank you. That oftentimes the atlas gets a little out of whack with the forceps if they were pulled a little too hard. And it sometimes it may be a necessary evil. It's sometimes the doctors are doing it out of convenience and being a little too aggressive. They're missing their golf game. Other times, if the baby's stuck in the birth canal, mom death and baby death at childbirth. I think it's more important that we just get that baby out and do the very best to save everybody's life. But getting the atlas put back, especially any kind of birth trauma like that, I think is very important. And I've heard nothing but great things about those chiros who specialize in babies and mamas like that.
And just as a side note to that, we have a practitioner friend of ours that has scoliosis, and we've used the same mullein root in mullein stock, and she's had Maxie's thing. She's had great success. We've watched her straighten up, like really.
Yeah, it was fun watching the shock and awe on her face.
Yeah, it was amazing to have that happen.
And I should say this as well. Oh my God, what's his name? Yoga dude, the St. Pete Yoga. He actually had horrible scoliosis. I can't think of his name. I'm so embarrassed.
Right there.
St. Pete Yoga. Oh, she's already left. She would know.
They're in the back.
Yeah. St. Pete Yoga, he as a teenager had horrible scoliosis where he had to wear the thing screwed in and all of this. And he has, thank you. And has pictures, he has x-rays of this horrible spinal curve. And it was as an older teen or in his 20s, he started to seriously practice yoga, specifically try to address that. And you can see the, years later of serious practice of yoga, that his spine was almost perfectly straight. So I think we shouldn't just accept, oh, my back's screwed up, I'll just get a massage. And nothing wrong with a massage for it, but there has to be a focused, concerted effort for it. And
Chris Acosta.
Yes, thank you. And I will say, acupuncture can play a role in that. Herbs can play a role in that. Because of cost issues, I have not told people that I can cure your scoliosis. because they would probably need to come in 2 or 3 times a week for years potentially. And I don't think that's fair when there might be, I can't promise them I would have success. And I think there might be better approaches to use acupuncture in conjunction with yoga, massage, chiropractic, and potentially, even if it's in the extreme, maybe you have to do surgery. That then the herbs and acupuncture can be a nice addition to help a variety of different things.
Let me say something about that too, because obviously I'm stubborn and obviously I don't want to get surgery, because any normal person many times over would have had a surgery, at least one, considering what I just told you. And we don't ever want to act like we're shaming somebody for their decisions one way or the other, because everybody has their own reasons for what they do. And I just have walked through a scenario with a mom with a child who gained 5.5 inches after her surgery as a teenager because the pain was just too much. And they had done, it was a hippie mom that's a friend and an herbalist, and they'd done everything that they were supposed to do, everything they could, and they finally succumbed to this, and it's been magical. And she was up and walking after a 20-hour surgery. Like, it's been a wonderful thing for sure. But the herbs and all of those other things can help through that. And we've also seen people who are all curled up. I have a child that's got scoliosis and kyphosis, so that's a bend and a twist. And you don't see signs of it unless...
Sounds like a 50 stance.
It's not a 50 stance, a bend and a twist. And you don't see signs of it unless he's slacking on what I've trained him to do since he was a small child. And I've even put the kinesiology tape on his back, so when he's doing computer work, he just gets a little bit of straighten up. A reminder in doing that he was a runner and it would impede his lungs. And so I had to keep pulling him back. And it works. When it's not a severe case, it really is, it goes a long way. And so doing all the things that Bob said really can be a plus as well. So don't, either way, we can support a surgery or we can support not a surgery, and we're very successful. So please, I encourage you to try all alternative routes, holistic view of things, for sure.
You know, I hate to say it, you know, the plus of getting surgery and so forth. King Tut died at 18, and they were doing brain surgery in Egypt at the time, you know, and a lot of it was thought to be because he had such bad scoliosis that he was all twisted up.
You want me to go?
Yeah, what do we got? And while Renee's looking, I'm going to do a selfless plug, except that I lost, there it is. If you don't know, Herb Day's tomorrow. If you're in around the Tampa Bay area, you should come to Herb Day 10 to 4. Lectures, food, music, all kinds of cool stuff. But our last Western Herbal 101 is coming up May 15, 16. I want to say it's almost full. I think somebody actually just dropped out because it was I want to say it was full. And also one for everybody. You don't need any prior herbal training or anything. Herbal Animal Care is June 19th to 20th. That will be both online live as well as in person. So whether you want to up your herbal practice and start seeing puppy dogs and kitty cats, and we'll even talk about a lizard or two. Or if you're just like, hey, I got critters, how do I better care for them as I care for myself? We have a lot of fun. We'll bring Cody the dog and torture him endlessly. And also for those of you who are doing herbal classes, or even if you're not doing herbal classes, a lot of us haven't had a science class since the beginning of time. And Tricia is teaching 2 hours of each body system to get our heads back in that anatomy physiology game, kind of the anatomy and physiology.
And it is online, so if anybody wants an anatomy and physiology for the herbalist minded, it is online. Yeah,
it's so far we've had lots of people showing up, and people are really happy. We record it. We'll send you the PowerPoint after the class and everything. So check the traditionsherbschool.com for more information on those open classes that are coming up. All right, what else we got? I was stalling for you so you could find me another question.
Seeing a client with sarcoidosis. Are you familiar?
Yep.
I'm wondering if you had any insights to the condition. It's my first case. It's Wyatt. And I'm seeing lots of phlegm, stagnation, lung chi issues, and always very cautious with autoimmune. So he's wanting any kind of input that we could have.
Boy.
Mm-hmm.
That's my short answer.
It's lung inflammation.
I wish I could say there was an easy answer to the sarcoidosis. I've seen a couple of cases. It's work. Um, the and your assessment sounds correct as well. So in the advanced stages, you might actually see blood stagnation as well, and then after that, you start to see the deficiencies take over, sadly, into death and so forth. In the case, I want to say almost every case I've seen of that, the phlegm is kind of dry and sticky. And so you frequently have to, and it seems counterintuitive sometimes, that you have to moisten in order to break that phlegm up and break it down to reabsorb it back into the water.
I have totally something to say about this. Wyatt and everybody's listening that wants to listen. I've had, in the past 2 years, I've had 2 cases of this, and the one was very, very, very severe. Coughing up blood, couldn't breathe, in the hospital several times, but they were an Uber driver and the sole breadwinner of the family, and was just really unwilling to deal with being sick. So she dealt with it several ways. But from our standpoint, when she was here, she was hyper about her diet, which was good. But when she was here, what Bob is saying is actually very valid, because Wyatt, you'll know this from hearing it from us, but I'm not sure everybody else will know, that Sita went a really long way, because it has like antimicrobial properties that would help if there was an infection that came up, but because it's balancing and moisturizing and can help get oxygen and breathe, that it would help to move what was going on, Biden's and Sita. So we do a normal long, she did have expressions on her skin, and she didn't mind that as much, which she should have, because it was so irritating. She just needed to breathe. That she very much could have been on oxygen, and she just was a hardworking woman that wasn't going to tolerate it. And so we wanted to control, she had bleeding in her lungs at some point, and we wanted to control the fact that she wasn't getting them oxygenated, because there was sores, patches, lesions, however you want to ID it, that then eventually went to like hard, stuck places. And so the Sita went a long way to helping us figure out, like, it would go in there and do what it needed to do.
And Wyatt, I know I just threw crazy Chinese things in there, and I'll explain what those are, and not to say any of those are correct. Dananjing is the processed Jack in the Pulpit, so it's a poisonous herb that is specific for that sticky phlegm. And so don't try that at home, kids. And so that's something you can look at just as an herb within the Chinese realm. Yunnan Bayao, Renee mentioned that it can become spitting up of blood, coughing up of blood, and so forth. And so the Yunnan Bayao is a formula for stop bleeding that can be used, but I would say not a safe long-term use formula. And I would say situationally more than anything. And then you can also look at the Chinese formula Wen Dun Tong. I think I spelled it right, but don't quote me on that. Warm the gallbladder formula. But really to help peel away that sticky tongue coating. And it will usually start to move pretty fast. And so once that tongue is half cleared, I would move away from that formula. But you can also look at things, I know where you are, okra, like some pickled okra, and start to use that both as food and medicine. Springtime, you might start having some of the thistles start to come up, that you could utilize that.
So a problem with this, Wyatt, everybody, but Wyatt, a problem with this is that reaction that you're seeing either in skin patches or on the lungs, you're getting in all your other mucous membranes too. So there's like dry patches in the eyes that mimic what you're seeing on the body if they have those. And so Bob's right that any way that we can get, like from an autoimmune standpoint, any way that we can take their flare down, and any way that we can get everything all like lubed up properly, it'll be able to move stuff out and heal. It won't have an over response. And so that will help all kinds of things that are going on. But just remember that portion of it. All the other mucous membranes are having a hard time too.
So I went to the MD Oriental Market here. It's a local grocery store, like public-sized Asian market here, because I got to make weird things like jellyfish and black chicken, white phoenix soup, and so forth tonight. And one of the things, I always pick up a few things. I was like, oh, people don't know what this is, or they're medicine that we don't think about as medicine. And I think one of the things I grabbed actually was a box, or not a box, but a package of okra. And okra is African medicine, it's Caribbean medicine,
It's a Malvaceae.
and it's a Malvaceae, it's the mallow family. And I'm always so, people are shocked when I was like, I can't eat okra, it's disgusting. And when they tried pickle okra, it is so good. And it cuts down on the snot factor, but okra is phenomenal medicine. I think it is one of the most overlooked food medicines that we have out there. And for softening that phlegm, for clearing arteries out, it is one of my go-tos. The other one is artichoke. Artichoke is the flower of a thistle.
So actual artichoke, like food?
Yeah.
Okay.
And so I don't care whether it's pickled, I don't care whether it's canned or bottled or fresh. But we use, everybody talks about milk thistle and forgets all the other thistles. We have blessed thistle, we have milk thistle, we have bull thistle and sow thistle and all of those things, daji, sauji. So eating both the okra and the artichoke can have a dramatic impact on phlegm, but also the phlegm of the liver in particular, where
it's expressed in your skin, in your outer mucous membrane, so that's why Bob's going liver.
Yeah.
And so those are all really good ideas. And two, also remember, if it's somebody who's persnickety, that they now have dried and like okra jerky that even when you eat it,
the dried okra.
Yeah, it's crunchy and spectacular. And you eat it and you think, well, this is dried. It's not going to help me because you need it for the moisture. I get too much of it in my mouth and it gums all up immediately. So it does do it, but it doesn't have the slimy that everybody is concerned about that's not used to that. And so that's another way out of it. But those are great suggestions, 100%.
What else we got?
That's it. Like those are. Anybody got questions? We covered everything. We managed it 100%.
I'm sorry. Did we miss anybody? I'm looking back here.
No. We got everybody. People would have gone on more about things like clearing parasites and stomach peristalsis and that kind of thing. But no, we kind of got.
And I'll give I will. I will say this. Most people like. Parasites is a very imprecise word. And so there are different types of parasites. There's intestinal parasites. There's organ parasites like liver flukes and things like that. There's blood parasites, malaria. And ultimately, our body is internally and externally, we're covered with parasites. There's bacteria, yeast, fungus are all a type of a parasite, many of which we have a symbiotic relationship with. And so when we look at all those gut flora, that we actually take a parasite pill, it's called probiotics. We do fermented foods. And so when people say I muscle tested for parasites, I was like, if you can't tell me that it's a spirochete, if you can't tell me a more specific thing, and I'm not a big fan of muscle testing anyway, but the reality is telling somebody they have parasites is not helpful. Let's just say that. And if they haven't had an exposure, if they don't have specific symptoms, if they don't have little white grains of rice coming out of their butt, pinworms, every parasite has a specific life cycle and specific herbs that we would use in combination in order to address it, or prescription medications. It can be tested for by the gastroenterologist or the appropriate infectious disease person. And so I always tell people go and get a poop sample or blood sample or whatever they think it is so that we can appropriately address it. Otherwise, I'm going to say a majority of the time, you're going to cause a dysfunction by over-treating that stuff because it is you're using things that kill an organism and you're taking it in large quantities for a long period of time. There's a really big organism you don't want to kill. And so it can cause some real damage. When I see people using some of the artemisias, the black walnut, the clove, and so many other things, and sometimes they start doing some really creepy over-the-counter stuff, that I've seen some real damage from that. So from a Chinese perspective, we generally talk more about creating balance, rather than killing stuff.
I have a question.
Yo.
So you just gonna get it in under the wire. Speaking of gums, thank you for the wittiness. If the gums are starting to bleed and there is a rapid recession beyond just a few millimeters a year, are there any herbal products or herbal things to regain gum tissue?
Heck yeah.
What can I do to help face things like cavity or any other serious dental issues? FYI, Bob can spew tons of things out to you about this. Plus, our friend Leslie Alexander has
There's a good
herbal
book.
dental book called The Herbal Dental Book.
Yeah.
It's Leslie Alexander.
It's a Western book. She rocks. Renee and I are both teaching at international conference this year. It's online. I'm sorry to say, I can't wait to be back there. It's every 2 years. Leslie Alexander. She's been pigeonholed as the dental herbalist because of the book she wrote, but she's an awesome herbalist for 1,000 different reasons. And she's doing one on pirate herbalism. And I'm like, oh my God, I'm so watching that one.
Not pirated herbalism,
No.
but the herbalism of
For
pirates.
pirate.
Scurvy and whatnot.
And I was like, I keep threatening to call her so I can tell her all of the sea lore, Bahamian fish bladders for lost limbs and things like that. And neither one of us have managed to match up our time. So gum issues, it's so funny. The bleeding gums, I usually start with, certainly if there's any kind of chronic gum disease, gingivitis and so forth, that can start to break it down. But if it's just bleeding gums, I usually look to a vitamin C deficiency. There's a capillary fragility, vitamin C sometimes being at the root of that. Scurvy, we lose our teeth. And no, certainly no one will ever have scurvy in the modern age. The Linus Pauling Foundation actually speaks that diabetes has a relationship to scurvy.
What Western herbs would you give for vitamin C? I know right now that with capillary fragility, hibiscus.
Yeah, I was trying to think of if I knew anything other than hibiscus. So hibiscus would be one.
Anything
the citrus peels, anything in the rose family.
Hawthorn berry.
But when it comes to the receding gums and gingivitis, plaquey kind of things, there's a couple of directions. I've had really good success using a frankincense or myrrh or Google based toothpaste, or you can make your own tooth powder with those things. It's a little bit of work.
If you add trace minerals to them, you can re-enamelize, and now the dentist will even admit to that being true. So you can just put a little capsules of some trace minerals in there. I have a good video about it.
It's not very enjoyable, but adding something with berberine, Oregon grapefruit, huanglian, which is coptis, also things with tannins, in particular oak bark. The inner bark of oak. You can also plantain would be a great choice.
Santiago Major, not the banana.
And some of the chew sticks that are out there, yellow root, which is a southeastern chew stick here in the United States, because I think you're in Canada, so you probably have Oregon grapefruit up there. Oak certainly you would have up there.
Mm-hmm. So let's do some basic principles. We have to make sure that you're having good vitamin C and you don't have capillary fragility, tone in your vascular system that's been missing. So that's the first thing. We need to make sure that you have the right mineralization and vitamins, because that would account for something like that. Anything having to do with the blood. So in Western herbalism, that's going to be red things. So it would be things like hibiscus and stuff that goes to the whole circulatory system. And then tissue knitting. So all resins are tissue knitting. So when we extract resins from calendula, that's tissue knitting and antimicrobial. Bob said the frankincense and the myrrh, any of our resins. So that's even rose and lavender and all of our flowers if we get the resins out of them. So anything tissue knitting. And then Bob also said tannins for tightening up those tissues and making them tonified. So plantain in the Celtic version has tannins in it and it's tissue knitting. So that's going to be a really heavy hitter. And so anything soothing trauma and tissue that's resinous, and anything that is going to help with the blood being toned, the vascular system. Witch hazel?
Yeah, witch hazel.
Witch hazel?
I mean, there's
butcher's broom?
Maybe.
Yeah.
So our time always goes really fast. So I appreciate everybody hung in. For everybody who bothers to listen to it online, it'll be up on YouTube here by Monday or Tuesday. Please come join us for Herb Day here in St. Pete, Florida. If not, check out, there are some online live streams tomorrow for Herb Day. And if you don't want to do any of those, do something cool and herbal and celebration and, text a friend and wish them a happy Herb Day. Check us out on traditionsherbschool.com. Follow us on
Instagram,
YouTube. There's lots of cool videos on YouTube if you haven't discovered it. And someday we maybe even be able to monetize it. Come get a treatment. Come be a student. Join us online. Don't forget we got the animal care class and all kinds of other cool stuff. And we'll see you the last Friday of next month. So, woo woo. Good night, all. Oh, hey, Babsy. Didn't know you were on there.
Bye, you guys. Remember, there's a delay, so you might have to wait a second and watch the things come in. Bye.